Question 1. A patient presents for a bilateral screening mammogram. The procedure is performed using computer-aided detection, CAD. How would you report this service? A. 77065, 77063. B. 77067. C. 77067, 77052. D. 77066. Answer: B. 77067. This question tests your knowledge of bundled procedures in mammography coding. The keyword screening directs you to the screening mammography codes, while computer-aided detection is also a critical detail. CPT code 77067 represents a screening mammography, including computer-aided detection, when performed. Since the introduction of this code, separate reporting of CAD, like with add-on code plus 77063, is incorrect for a screening study. The simple takeaway is that modern screening mammography codes often bundle the main procedure and CAD into a single, comprehensive code. Question 2. A patient undergoes a CT scan of the pelvis first without contrast material, and then again with contrast material. Which CPT code should be used? A. 72192. B. 72193. C. 72194. D. 72192, 72193. Answer: C. 72194. This scenario tests your understanding of how to code for contrast administration in CT scans. The key phrases are without contrast and then again with contrast, indicating a combination study was performed during the same session. CPT provides a single, specific code, 72194, for a CT of the pelvis performed without contrast material followed by contrast material. Reporting the without code, 72192, and the with code, 72193, separately would be incorrect unbundling. As a rule, always look for a combination code in the CPT manual when a study is performed both without and with contrast. Question 3. A radiologist performs the supervision and interpretation for a percutaneous needle biopsy of a single lesion in the liver, using ultrasound guidance. How are the radiologist's services coded? A. 47,000, 76942. B. 47,100. C. 76,942. D. 47,000. Answer: A. 47,000, 76942. This question focuses on coding for interventional radiology, which often requires reporting both the procedure and the guidance used. The keywords are needle biopsy of a single lesion in the liver, the procedure, and ultrasound guidance, the imaging. The biopsy itself is reported with 47,000, and the separate service of using ultrasound to guide the needle is reported with 76942. Parenthetical notes in the CPT manual often instruct coders to report guidance codes separately. The tip here is to remember that for many invasive procedures, you must code both the what, the biopsy, and the how, the guidance. Question 4. A patient has a complete ultrasound of the abdomen. Which of the following organ examinations would be required to report the complete code 76700? A. Liver and gallbladder only. B. Kidneys, ureters, and bladder. C. Liver, gallbladder, common bile duct, pancreas, spleen, kidneys, and the upper abdominal aorta and inferior vena cava. D. Aorta and inferior vena cava only. Answer: C. Liver, gallbladder, common bile duct, pancreas, spleen, kidneys, and the upper abdominal aorta and inferior vena cava. This question assesses your knowledge of the specific documentation requirements for a complete versus a limited ultrasound. The term complete has a very specific definition in the CPT manual for an abdominal ultrasound, 76700. To use this code, the radiologist must document the examination of all the listed elements: the liver, gallbladder, common bile duct, pancreas, spleen, kidneys, and the major blood vessels. If any of these elements are not documented, the study must be coded as a limited ultrasound, 76705. Remember this key tip: always check the CPT code description to ensure the physician's documentation meets the specific requirements for a complete study. Question 5. In a hospital setting, a radiologist reads and provides a written report for a 2-view chest X-ray. The hospital owns the equipment and employs the technologist. Which modifier should the radiologist append to the CPT code? A. TC. B. -26. C. -52. D. -59. Answer: B. -26. This question tests the concept of the professional versus the technical component of a radiology service. The keyword is reads and provides a written report, which describes the physician's interpretive work, known as the professional component. Modifier -26 signifies that only the professional service was performed. The hospital would bill for the use of the equipment and the work of the technologist using the TC, technical component, modifier. A helpful way to remember this is that modifier -26 is for the doctor's brain work, the interpretation and report. Question 6. A patient is sent for a chest X-ray because of a persistent cough. The final report by the radiologist states normal chest X-ray. What is the correct ICD-10-CM code to link to the procedure? A. A code for normal findings. B. The ICD-10-CM code for cough. C. A code for pneumonia. D. A code for observation without medical findings. Answer: B. The ICD-10-CM code for cough. This scenario tests the crucial ICD-10-CM guideline for coding signs, symptoms, and inconclusive findings. The key concept is to code the reason for the encounter, which was the persistent cough. Even though the X-ray result was normal, the test was medically necessary to investigate the symptom. You should not code the findings, or lack thereof, from the test itself. Instead, you report the sign or symptom that prompted the order. The takeaway is to always code the reason for the test, not the result. Question 7. A patient undergoes an MRI of the brain without contrast. Later on the same day, the patient's condition changes, and the treating physician orders a second MRI of the brain, this time with contrast. How should these two separate encounters be coded? A. 70553, MRI brain without, then with contrast. B. 70551, 70552. C. 70552. D. 70551, 70552 to 59. Answer: D. 70551, 70552 to 59. This question tests the application of modifiers when two related but distinct procedures are performed on the same day. Unlike a pre-planned, without and with contrast study, 70553, these were two separate sessions ordered at different times due to a change in the patient's condition. The first scan is coded with 70551, MRI brain without contrast, and the second is coded with 70552, MRI brain with contrast. Modifier -59 is appended to the second code to indicate it was a distinct procedural service from the first one and not a bundled component. The tip here is to pay close attention to the timing. If the with contrast portion was not part of the original plan, it's typically coded as a separate procedure with a modifier. Question 8. A patient receives a diagnostic mammogram of the right breast only. What is the correct CPT code? A. 77067RT, B. 77065RT, C. 77066RT, D. 77067. Answer: C. 77066RT. This question challenges your ability to differentiate between screening and diagnostic mammograms, as well as bilateral versus unilateral procedures. The keyword diagnostic rules out the screening code 77067, and right breast only indicates a unilateral procedure. CPT code 77066 is specifically for a diagnostic mammogram of a single breast. The modifier RT is appended to specify that the right breast was imaged. Always remember to check if the mammogram is for screening, no symptoms, or diagnostic, investigating a problem, purposes, as this is the first step in selecting the correct code. Question 9. What does the term frontal and lateral refer to in the context of a chest X-ray? A. The number of years the patient has been a smoker. B. The type of contrast material used. C. The positions of the patient, indicating 2 views were taken. D. The type of machine used to perform the X-ray. Answer: C. The positions of the patient, indicating 2 views were taken. This question tests basic medical terminology and its application in radiology coding. Terms like frontal, or postanterior, PA, and lateral describe the path of the X-ray beam through the body and correspond to the different positions the patient is placed in to get a comprehensive image. In coding, identifying these terms in a report is key because many X-ray codes are defined by the number of views taken. For a chest X-ray, frontal and lateral tells the coder that 2 views were performed, leading them to select the appropriate CPT code, e.g., 71046. The key takeaway is that positional terms like frontal, lateral, and oblique directly translate to the number of views you need to count for accurate coding. Question 10. A nuclear medicine procedure that uses a radiopharmaceutical to create 3-dimensional images is known as A. SPECT, B. DEXA, C. X-ray, D. MRI. Answer: A. SPECT. This question tests your knowledge of different imaging modalities, specifically in nuclear medicine. SPECT stands for Single Photon Emission Computed Tomography, which is a nuclear imaging technique that uses a gamma camera to create 3D images after a radiopharmaceutical has been administered. Unlike a standard 2D nuclear scan, SPECT provides a more detailed, cross-sectional view similar to a CT scan. Remembering acronyms is key in radiology. SPECT is specifically the 3D version of a nuclear medicine scan, which sets it apart from other modalities. Question 11. Which CPT code is used for a CT scan of the cervical spine performed with contrast material? A. 72125, B. 72126, C. 72127, D. 72126, 72125. Answer: B. 72126. This question is a straightforward test of locating the correct CPT code based on anatomy and contrast use. The keywords are CT scan, cervical spine, and with contrast material. Following the CPT index to the spine and pelvis section for CT scans, you will find a series of codes for the cervical spine. Code 72125 is for a CT without contrast, 72126 is for a CT with contrast, and 72127 is for a study done without and then with contrast. Since the report only specifies with contrast, 72126 is the correct choice. Always read the code descriptions carefully to match the exact service provided. Question 12. Radiological supervision and interpretation for a barium enema is coded from which CPT code series? A. 74240 to 74245. B. 74,270 to 74,283. C. 74,150 to 74,178. D. 71,045 to 71,048. Answer: B. 74,270 to 74,283. This question tests your ability to navigate the CPT manual to find the correct section for a specific type of study. A barium enema is a fluoroscopic examination of the lower gastrointestinal tract, the colon. In the CPT manual, these procedures are found in the gastrointestinal tract subsection of radiology. The code range 74,270 to 74,283 specifically covers contrast enemas, including those with air contrast. Familiarity with the CPT manual's layout is essential. Knowing that a barium enema is a GI study helps you quickly find the right code range. Question 13. A patient undergoes a radiological examination of the knee with 4 views. The correct CPT code is A. 73,560. B. 73,562. C. 73,564. D. 73,565. Answer: C. 73564. This question assesses your ability to select the correct CPT code based on the number of views documented for a plain X-ray. The crucial information is knee and 4 views. In the CPT manual under the lower extremities section, the codes for knee X-rays are differentiated by the number of views. 73560 is for 1 or 2 views, 73562 is for 3 views, and 73564 is for 4 or more views. Since the report specifies 4 views, 73564 is the correct code. A key takeaway for musculoskeletal X-rays is that the number of views is one of the most important factors in choosing the right code. Question 14. What type of guidance is considered inherent to a lumbar puncture procedure and is not separately billable unless it is extensive or medically necessary and documented? A. CT guidance. B. Ultrasound guidance. C. Fluoroscopic guidance. D. MRI guidance. Answer: C. Fluoroscopic guidance. This question addresses the concept of bundled services and when imaging guidance can be reported separately. For a diagnostic lumbar puncture, 62270, the CPT manual includes a parenthetical note stating not to report fluoroscopic guidance, 77003, separately, as it is considered integral to the procedure. However, if more advanced guidance like CT or MRI is used, it can be reported separately because it is not considered a standard part of the procedure. The tip is to always check the notes following a CPT code, as they provide critical instructions on what is included and what can be billed separately. Question 15. The technical component of a radiological procedure, indicated by modifier TC, typically covers the cost of A. The radiologist's written interpretation and report. B. The equipment, supplies, and technical staff. C. The referring physician's office visit. D. The hospital stay for the patient. Answer: B. The equipment, supplies, and technical staff. This question is about defining the technical component, TC, of a procedure. The key concept is that a radiology service has 2 parts: the professional service, the doctor's interpretation, and the technical service. The technical component, identified by modifier TC, covers all the non-physician aspects of the procedure, such as the use of the expensive imaging machine, the room, the supplies, like contrast, and the salary of the technologist who operates the equipment. Remember this simple breakdown: TC is for the things and technical staff, while -26 is for the thinker, the radiologist. Question 16. A DEXA scan is a type of radiological test used to measure A. Brain activity, B. Blood flow in the heart, C. Bone mineral density, D. Fetal growth. Answer: C. Bone mineral density. This question tests your knowledge of common radiological procedures and their purposes. DEXA, or DEXA, stands for Dual Energy X-ray Absorptiometry and is the gold standard for diagnosing and monitoring osteoporosis by measuring bone loss. Knowing the purpose of different tests is crucial for understanding the medical necessity documented in a patient's record. A handy tip is to associate DEXA with bone density to easily remember its primary function in diagnosing conditions like osteoporosis. Question 17. When a radiologist provides a formal, written report, e.g., for a second opinion, on an X-ray that was taken at another facility, what CPT code should be used? A. The CPT code for the X-ray with modifier -26. B. The CPT code for the X-ray with modifier -77. C. 76140, consultation on X-ray examination made elsewhere, written report. D. An E/M consultation code. Answer: C. 76140, consultation on X-ray examination made elsewhere, written report. This scenario tests your knowledge of a specific and sometimes confusing coding situation, interpreting an outside image. The key phrase is X-ray that was taken at another facility. In this case, you should not use the standard CPT code for the X-ray, like 71045, with modifier -26 because your facility did not perform any component of the service. Instead, CPT provides code 76140 specifically for the professional service of reviewing and providing a written report on an imaging study performed elsewhere. Always remember, if the image comes from an outside facility, look for a consultation code like 76140. Question 18. A patient undergoes an X-ray of the sacroiliac joints. The report documents 3 views were taken. Which CPT code should be reported? A. 72200. B. 72202. C. 72220. D. 73521. Answer: B. 72202. This question tests your ability to accurately code a plain X-ray based on both anatomy and the number of views. The key anatomical term is sacroiliac joints, and the crucial detail is 3 views. In the CPT manual, code 72200 is for an X-ray of the sacroiliac joints with fewer than 3 views. Code 72202 is used for a study of the sacroiliac joints that includes 3 or more views. Therefore, since 3 views were performed, 72202 is the correct code. This highlights the importance of carefully counting the documented views to select the most specific CPT code available. Question 19. The HCPCS Level 2 codes, such as A9500 and A9699, are used in a radiology setting to report what? A. Transportation of patients to the radiology suite. B. Radiopharmaceutical drugs. C. Surgical trays used in interventional radiology. D. Non-physician provider services. Answer: B. Radiopharmaceutical drugs. This question assesses your knowledge of the different code sets used in medical billing, specifically HCPCS Level 2. The key clue is the code range A9500 and A9699, which is designated for radiopharmaceuticals. While CPT codes describe the nuclear medicine procedure itself, like a PET scan, these HCPCSA codes are used to report the specific radioactive drug that was administered to the patient for the scan. A good tip is to remember that CPT is for the procedure, while HCPCS Level 2 is often for the supplies, drugs, and other materials used. Question 20. A complete, bilateral ultrasound of the breasts is reported with which CPT code? A. 76641. B. 76642. C. 76641 to 50. D. 76642 to 50. Answer B. 76642. This question tests your understanding of how unilateral and bilateral are described in CPT for breast ultrasounds. The keywords are complete and bilateral. CPT code 76641 describes a complete ultrasound of a single breast, unilateral. CPT code 76642, however, is specifically defined as a complete ultrasound of both breasts, bilateral. Because the code description for 76642 already includes the concept of bilateral, it is incorrect to append modifier -50, bilateral procedure. The important takeaway is to always read the full CPT code description, as some codes are inherently bilateral and do not require a modifier. Question 21. A patient presents for a CT of the abdomen and pelvis with contrast. How should this be coded? A. 74160, 72193. B. 74177. C. 74170. D. 74176, 72194. Answer B. 74177. This scenario tests your knowledge of combination codes for CT scans that cover more than one body area. The key phrase is CT of the abdomen and pelvis. The CPT manual has a specific set of codes for when these two contiguous body regions are scanned in the same session. Code 74177 is the single code that represents a CT of the abdomen and pelvis with contrast. Reporting separate codes for the abdomen, 74160, and pelvis, 72193, would be incorrect unbundling. A helpful tip is that whenever a report mentions both the abdomen and pelvis, you should immediately look for the dedicated abdominopelvic combination codes. Question 22. A radiologist performs fluoroscopic guidance for the placement of a central venous access device. The CPT code for this guidance is 77001. What does the description of this code specify about where the catheter or device tip is located? A. It is located in the peripheral venous system, e.g., arm. B. It is not a central venous access device. C. It is a non-vascular access device. D. It is located in the central venous system, e.g., vena cava. Answer D. It is located in the central venous system, e.g., vena cava. This question tests your detailed understanding of a specific guidance code's description and its proper use. The description for 77001 is fluoroscopic guidance for placement of central venous access device, catheter, or stent. The term central venous is the key, meaning the tip of the device must terminate in a major central vein like the subclavian, brachiocephalic, iliac, or vena cava. If the device were placed in a peripheral vein, like in the arm, this code would be inappropriate. This highlights the need to understand anatomical definitions within CPT descriptions to ensure accurate coding for guidance procedures. Question 23. An MRI of the lumbar spine is performed without the use of contrast material. What is the correct CPT code? A. 72148. B. 72149. C. 72158. D. 72146. Answer A. 72148. This question is a direct test of your ability to locate a CPT code based on anatomy, modality, and contrast usage. The key elements are MRI, lumbar spine, and without contrast. Navigating the CPT index to MRI of the spine will lead you to the codes for the lumbar region. Code 72148 is for an MRI of the lumbar spine without contrast, while 72149 is with contrast, and 72158 is without followed by with contrast. Since the procedure was performed without contrast, 72148 is the only correct choice. Always break down the service into its core components, modality, anatomy, and contrast, to find your code. Question 24. A patient has a babygram, which is a single X-ray of the entire body on an infant. How should this be coded? A. 76010. B. Code for a 2-view chest X-ray. C. Code based on the reason for the exam, e.g., suspected abuse. D. 71045, 72020, 73592. Answer: C. Code based on the reason for the exam, e.g., suspected abuse. This question tests your knowledge of a specific coding guideline regarding babygrams or single-view infant body X-rays. The key term is babygram. According to CPT guidance, there is no single code for this procedure. Instead of trying to bill for multiple body parts, you should select the single CPT code that best represents the primary reason for the exam. For example, if the X-ray was done to evaluate the chest, you would use a chest X-ray code. This prevents unbundling and reflects the focus of the radiologist's work. Question 25. An X-ray of the orbits, sella turcica, and internal auditory meaty is performed. How many codes are required to report this service? A. 3 codes, 1 for each area. B. 1 code. C. 2 codes, 1 for the orbits and 1 for the sella/meaty. D. 1 code with 3 units of service. Answer: B. 1 code. This question tests your ability to identify when multiple, closely related anatomical sites are bundled into a single CPT code. The keywords are the specific skull structures, orbits, sella turcica, and internal auditory meaty. In the CPT manual's head and neck section, code 70030 is described as radiologic examination, I, for detection of foreign body. However, more complete skull X-rays often group related structures. The most appropriate code would be a single, comprehensive skull code, e.g., 70260 for a complete skull X-ray, minimum 4 views, as these individual areas are components of the skull. You would not code each area separately. The tip here is to recognize that when multiple small, adjacent structures in one anatomical region are imaged, there is often a single, more comprehensive code that should be used.